You're going on Medicare. What a great opportunity for you. Why? Once you're on Medicare, you're going to realize how good this system is. So in this video, what I'm going to do is go over original Medicare, Medicare Part A and Part B. That is the foundation of Medicare. Everything is built off of that. Once you understand those two principles, you'll be able to make some really good decisions down the road. Why is this a great opportunity for you? Guys, I'm on Medicare myself. And when I went on Medicare, it was the best thing because look at Obamacare. It's expensive. The premiums are through the roof. You have high out of pocket. You have high copayments. You have very small networks. With Medicare and a supplemental plan, my premium is low. My out of pocket is almost zero. I can go to any doctor in the United States, any hospital in the United States. I need no referrals. I just go and have it done. So I have the best health insurance in the country. And that's what I want to go over with my videos, is show you how to find that. One other thing before I get into the video, I would recommend strongly you subscribe to the channel, my channel. For this reason, I'm setting up a new kind of channel. I'm not setting up a channel trying to just inform you of things. I want to keep you informed on things. So what I'm going to do is when things with Medicare or the government or insurance companies change, that directly impacts you guys. I'm going to put up a news video, 60 seconds long, 30 seconds long, just to inform you. Things happen along the way that people don't know about. There's been major changes folks are not aware of. A quick one, Plan F is being taken off the market in 2020. Most people with Plan F don't know it. They have no clue. So if you subscribe to my channel, you'll stay abreast with things. Okay? So just go ahead, down below, hit it, and then we can go on. All right, let's go on to Part A. As you guys know, there's 4 parts to Medicare. Part A, B, C, and D. A, hospitalization. B is doctors and outpatients. C, Medicare Advantage. Click on that link and you'll go to a video. We'll talk about Medicare Advantage and how to buy one. D, Part D, the prescription drug program you've all heard about. Again, I have another video, and it's more of how to get the best prescription drug plan. That's something you really, really want to keep because it's something you got to review on an annual basis. So, Part A. Medicare does a really good job, guys, under Part A. They pay for everything, everything. The only thing they don't pay for is small items, personal items that you might order specifically. But other than that, they pay it all. You go in, there's a deductible. It's a 60-day deductible, we call it. And what that means is that, you say you go in for a heart condition, you get treated, you get released, and you go back 2 weeks later for that same heart condition, there's no deductible. As long as you go back in within that 60-day time frame. If you wait, if it's longer, say 3 months down the road for the same problem, that's a new deductible. But people who work with me, they all have generally Medicare supplements. All supplemental plans that I will ever recommend will pay all those deductibles. Because besides the deductible, after 60 days, Medicare starts hitting you with copays on a daily basis, and they get pretty expensive. And all supplemental plans will pay that for you. You really don't have to worry about hospitalization costs under Medicare. Medicare does a really good job, and with a quality supplemental plan, you are really well covered. The next thing I want to talk about now is nursing home coverage. There is a benefit under Medicare. It's not a great benefit. There is a benefit, though. But to qualify for Medicare to pay towards a nursing home, there's certain requirements you must meet. First off is you have to be admitted into a hospital as an inpatient and spend at least 3 days. Once you meet those 2 requirements and you get transferred to a nursing home, then there's only one level of care Medicare will pay for, and that's called skilled care. There's 3 levels of care in nursing homes: skilled, intermediate, and custodial. Custodial care is, you might be more familiar with it as people who have Alzheimer's or dementia who just need custodial care. That's that. Skilled care is when you have a nurse round the clock or a lot of medical problems. That's skilled care. Medicare and a supplemental plan will pay for the first 100 days. After 100 days, you're on your own. One other area about the nursing home benefit I want to talk about is rehab. Many times today, with all these surgeries going on, people will require rehab after the surgery. And Medicare does pretty good. Medicare with a supplemental plan will pay the 100 days. But to meet that requirement, you have to be in the hospital as an inpatient. And there are old stories about people going into the hospital. They didn't have a surgery, but they were there because they fell down or something, and a doctor required them to go have some rehab afterwards. But they were admitted as an under observation. Under observation is critical for this reason. If you go with that classification and you have to go for rehab, Medicare will not pay the bill. The supplemental plan will not pay the bill. It's your bill. And there was problems a while back because people had that and they would go into a nursing home and they'd end up with a $20,000 bill that they had to pay. I do have a video that will explain it and show what happened. Nowadays, the hospital is supposed to tell you, but you should be aware of this, okay? Because you don't know what's going to happen when you go into the hospital. So make sure when you're in the hospital what kind of classification you have. The last benefit is home health care and hospice. I'm sure most of you know about hospice. You've heard people being with hospice. Hospice is a very, very good. Medicare pays it all. Under home health care, Medicare pays everything for the services rendered and on some of the durable medical equipment, but there's co-payments and supplemental plans will pay that for you. But you're very well covered. Guys, that's basically Plan A. I mean, there's more to it, a lot more to it, but that's the essential. Those are the things you really need to know about. If you really have questions, you can always call me up. I'll talk to you on the phone, and I'm not going to try and sell you anything. Just call me up, and we'll go over it for you, okay? So let's go on to Part B, because Part B is the big one that people have the most problems with. Medicare Part B, what does it cost? On the screen, you can see a chart. The chart is the breakdown of the monthly premium for you going on to Part B. As you can see, a single person making less than $85,000, $134. For a husband and wife, it's $134. And as you make more money, your Part B premium will increase. Now, if you are taking Social Security, that premium will automatically come out of your Social Security check. So there's nothing you need to do, and it automatically enrolls you into Part B at that point when you take a Social Security payment. If you're not taking Social Security, then you need to get hold of the Social Security office and sign up. Do it at least 3 months in advance. Even if you're still working and you think you're going to retire down the road, about 3-4 months before, get hold of these people and talk to them to get the ball rolling. Don't wait a week before you retire when you're going to lose your group health insurance and call up Social Security. It's too late at that point. You've got to do it. Also, if you are still working, make sure, call the Social Security office, because some folks don't need to take out Part B. Not everyone has to. And if you don't need it, don't do it, okay? Because especially if you're working and you have group coverage and you take out Part B, and then once you retire, if you lose your group coverage, that has some ramifications on getting supplemental coverage down the road. And if you have questions, you can always call me. I'll help you. I'll walk you through this, guys. Just give me a call. Okay, so those are your costs that you're going to incur when you go on Part B. Medicare Part B, what does it cover? Quite simply, it's everything outside of the hospital. Ambulance services, doctor services, specialists, chiropractor, lab work, x-rays, outpatient services at a hospital. That is Medicare Part B, quite simply. How much will Medicare pay now? Under Medicare, there's an annual deductible. It's called a Part B deductible. Right now in 2017, it's $183. Next year, it'll change. It can go up and go down. I have seen it go down. Rare, but it does go down, guys. All right. At the $183, once that is paid for, then Medicare will pay 80% of what we call the approved amount. You are responsible for the other 20%. Unless you have a supplemental plan, then your supplement will pay the other 20%. All the plans I ever recommend people will have that benefit. As a side note, if you guys are looking at Medicare Advantage, this really doesn't pertain to you because you don't have these kind of payments within Medicare Advantage. Medicare assignment, though, I mentioned that, and that's something you need to know. On billing, when a doctor performs their service, they bill Medicare with codes. Medicare has the whole country broken down by zip code of what they will pay in that area. And so the doctor sends in the code, Medicare will come back with what is the approved amount in that zip code. Meaning, no matter what the service is, Medicare has a specific amount for that service in your area. So the doctor could charge you, $500 for the service. Medicare could come back in, and Medicare is low. They can come back in and say $100. Of that $100 bill, Medicare will pay 80%. You pay the other 20%, or your supplemental plan will pay the other 20% for you. As a side note, I have another video that I've created on billing and assignment doctors. One is how to find an assignment doctor, how billing works, because that's important. People want to know that when they go to a doctor, the bills are going to get paid, especially with a supplemental plan. They want to make sure these things get paid for. So I have a short video, which will, I think, help you. And there's going to be some links in there on like how to find a doctor that accepts assignment. As another note, 96% of the doctors today accept assignment. That means they reduce their bill. Back in the 90s when I first got into this business, very few doctors accepted assignment. Most doctors charged whatever they wanted. And back in those days, they could charge whatever they wanted. Now that's pretty much Part A and B. And before you guys go away, there's something I have for you, and I think you might enjoy this. Down below, there's some links. One is to my Facebook page. Go there and follow it. The reason is I do a lot of updating on news that affects us, affects everybody that is on Medicare. And there's things that go on a daily basis that we don't know about, and you won't hear it. So what I try and do is keep you educated. I also have written a 10-page report. If you're going to buy a supplemental plan, you can download this off my website. There's a link below on how to get it, and I find it quite helpful. And I would really, really advise you looking at it. There's other videos I have here. I would suggest, again, go down to my channel page on this website on YouTube. There's a lot of videos, people, and I think they're going to be helpful to you. So if you have any questions, you can always call me at my office. My name is Jim Grudy. I'm the only one that answers that phone. Okay, I don't have a big staff, and we don't have tons of agents in here. We try and take care of people individually. So give me a call, and I'll see what we can do. Have a good day. Bye-bye.